Welcome to our first 2021 webinar from ACU Idea Lab. We're grateful you're able to join us today. These webinars will be recorded and available on our Idea Lab YouTube site, which will be emailed to you at the conclusion of today's session. On our DCS website, duncombecentersolutions.com, you can also learn more about what we do for professional development. If you would like more information on our online degree programs, please visit acu.edu/online. All of our online degree programs are designed for working professionals like yourself. Today, we will hear from Meghan Hope, who I will introduce momentarily. I'm Noelle Lawan, and I'm your host this afternoon. You will notice that all participants are muted and hidden, but there will be opportunities to participate in today's session using different functions found at the bottom of your Zoom window. Please use the chat for general intros, comments, and questions for Idea Lab. And be sure to click the drop-down window on your chat to choose all panelists and attendees so that our presenter can see your responses as well. Let's begin using the chat with everyone sharing their name and the city and state they're joining from. As you've seen in the past, we will also utilize the poll feature that will pop up on your screen to participate in. And if you do have specific questions for our presenter at the end of today's session, please use the Q&A feature. Here is today's agenda. Meghan's presentation is 3 tips for navigating the post-COVID-19 patient experience. I will close this out no later than 12:45 with some next step items, and we welcome anyone who'd like to stay after for a Q&A with Meghan. Feel free to go ahead and post any questions that you think of throughout the presentation in the Q&A feature, so that way they're ready at that time. During this webinar, you will reflect on the role of disruption in healthcare, gain information about the shifting landscape of healthcare delivery, and receive tips and tools for navigating healthcare services. Now, I'd like to introduce our presenter sharing some of her expertise with us today. Meghan Hope is an assistant professor and the program director for ACU Online's Bachelor of Science in Healthcare Administration program. Meghan received her Juris Doctor with a health law concentration from the University of Tulsa and a Master of Healthcare Administration from Midwestern State University. Meghan offers 15 years of expertise in the healthcare industry. Prior to joining ACU, she worked as a healthcare regulatory and operations consultant, focusing on new hospital development, management, and reimbursement issues. Meghan has served as an administrator in community-based and academic healthcare environments. Her research interests and passions include healthcare policy influences on management decisions and regulatory considerations in clinical research. I'm very happy to welcome Meghan Hope.
Hi, everyone. Thank you, Noelle, for the introduction. I am so happy to be here and to have the opportunity to share a little bit about my perspectives as we move forward and adapt to the changing healthcare landscape. Before I go any further, I would like to take a moment to acknowledge the healthcare workers who have worked tirelessly over the last year during this pandemic. To see your dedication and perseverance day in and day out and the sacrifices you have made to care for our patients is an inspiration. You are all truly heroes. And especially to our incredible students who are not only working in healthcare right now, but are also pursuing your dreams of achieving your education and career goals. It is my honor and privilege to be a part of your journey. Now, I have spent my entire career working in the healthcare industry. And throughout much of this time, it has seemed as though the healthcare industry has been on the precipice of change, but this change has really been arduous and slow. About 6 or 7 years ago, I was at a health law conference in Chicago, and I was attending the keynote address. And to be quite honest, I cannot even begin to remember the topic of the conversation. It was possibly related to changes in the ACA or something along those general lines. But I distinctly remember the introduction to the keynote address. The speaker was talking about the need for vast change in the healthcare industry. And specifically, she was focusing on the need to ensure high quality, affordable healthcare that is accessible to all. In her introduction, she then went on to state that healthcare needed an Uber. What she meant by this was that the healthcare industry needed a disruption, something that would force us to rethink the patient experience and the way that we deliver care. From framing the potential disruption in this context, this really has stuck with me ever since. In my consulting and my teaching, I have been following healthcare trends and innovations and slowly kind of waiting for that Uber to pop up. However, it hasn't really happened. Yes, there have been major improvements and innovations within the healthcare industry over the years, from anything from advances in technology to value-based purchasing, to clinical integration and coordination, and even a shift to improving the overall patient experience. But, much of this seemed to occur behind the scenes through the efforts of researchers, healthcare professionals, and stakeholders. And further, these changes only seem to impact segments of healthcare, such as third party payers, patients with a specific disease, or individual health systems. Nothing seemed to rattle healthcare as a whole. And this observation has led me to think about why the healthcare industry has been so hard to disrupt. But while reflecting upon this, it's important to remember the sheer size and impact of the healthcare industry. In fact, here is our first poll question. The question is, healthcare makes up what percentage of the US economy? Oh, and it looks like just about everyone got the answer correct at 18%. As a share of the nation's gross domestic product, health spending accounted for 18%. By far, the United States spends more on healthcare than any other country. In addition to the dollars spent on healthcare, this number has also increased faster than the average annual growth rate of GDP per capita. In all honesty, we could spend days talking about healthcare spending and why it has been so high in past decades, and is now starting. And now this GDP is starting to trend closer to current spending. But really, the key takeaway: the economic influences of healthcare. The United States healthcare system is also heavily driven by regulatory and government oversight. And now, on this next slide, I know it is really hard to read, and you're not even supposed to be close to even be able to read it. The purpose of this image is to show just how many regulatory agencies are involved in steering healthcare delivery. Just to name a few of the big ones, we have CMS, the Centers for Medicare and Medicaid Services, the Office of Inspector General. We have state level requirements such as Medicaid or licensing board for health, is that there's a lot of regulations and requirements in which healthcare providers must operate. And on a side note, my passion is helping healthcare organizations enhance their operations by working within these regulatory frameworks. So if you ever want to learn more about a healthcare regulation or a governing body, please feel free to reach out. I'm always happy to help answer those questions. Adding upon the amount of dollars at stake within the healthcare industry and the regulatory complexities, there are also many types of healthcare practices and organizations. To name a few, you have hospitals, physician offices, ambulatory care hospitals, assisted living facilities, and mental health services. This short list doesn't even include companies and business associates that develop technology, pharmaceuticals, and medical devices used in healthcare. So, based on just the sheer size of the health economy, the number of regulatory bodies involved, and the services and technology available, you can see why it has seemed almost impossible to disrupt healthcare in its entirety. And this really brings us back full circle to thinking about disruptors in healthcare. Although it is by no means an Uber, I think we were all surprised to see just how much COVID would impact our day to day lives. And it has certainly impacted every sector of the healthcare industry. As you can see in this quote here, COVID-19 is now probably the biggest disruptive force in the last century. More so than any single person or idea, it has made us redesign health services across the world. And among all of the uncertainties, loss, and challenges of the COVID-19 pandemic, it truly has transformed the way that we deliver healthcare. And I believe that a silver lining of this pandemic will be a transformation in the patient experience that ultimately leads to a healthier society. Now, the rest of this presentation will discuss what patients can expect when navigating care now and in the future. First, we will discuss telemedicine, followed by social determinants of health, and then we'll talk about healthcare reform and the ACA. I will give a brief overview of each topic, followed by a few tips for patients and best practices. And the first topic we will discuss is telemedicine. One of the major ways in which COVID-19 has disrupted and really revolutionized healthcare is the rapid expansion of telehealth services. The pandemic has shown the true value of telemedicine in limiting the spread of disease while also ensuring access to medical expertise. Before the pandemic, telehealth had been viewed as a promising innovation, but reimbursement regulations, provider and patient access, and really licensing criteria had stalled its potential. Before COVID-19, the largest telemedicine vendors focused on virtual urgent care, and this really helped consumers get on demand instant telehealth services, but it was typically with a provider that the patient did not have a relationship with or had not seen in the past. But as soon as COVID-19 hit, the mandatory appeals for social distancing and really the patient's desire to stay out of the physician's office made this technology an essential tool for adherence to these principles. In fact, providers have rapidly scaled offerings and are now seeing 50 to 175 times the number of patients via telemedicine than they were previously. It really has been fascinating to see how telemedicine has completely taken off and how providers really just had to adapt to this overnight. The consulting firm McKinsey and Company put out a report earlier this year. In the report, they estimated that telehealth revenues in 2019 equaled approximately $3 billion. They further estimated that with the acceleration of consumer and provider adoption and extension of telehealth beyond virtual urgent care, up to $250 billion of current US healthcare spend could potentially be virtualized. This comes out to approximately 24.5 million Medicare televisits. The report further estimated which types of visits could potentially be diverted. The report estimated that approximately 20% of emergency department visits could be diverted from being seen in person. I find this particularly interesting because controlling costs and throughput of emergency departments is particularly concerning for hospital administrators, and it can lead to very high medical bills for patients. The emergency department is also used as a primary venue for the uninsured, and those without consistent sources of primary care will use the emergency room for their point of care needs. However, if we can divert almost 20% of these visits, this can really help to free up emergency department visits and will also save patients money. The consulting company further estimates that 24% of office visits and outpatient encounters could be virtualized, and 35% of home health services. Now, the big question on everyone's mind lately has been, is telemedicine here to stay? It really is impossible to predict the future of telehealth past the pandemic. However, there will likely be some efforts to scale it back, but there have also been significant momentum in this area. And so it might be challenging to reel telehealth back in. But for the immediate future and during the public health emergency, telehealth is here to stay, and it will likely remain to some degree once the emergency has subsided. And within this slide, I'll discuss three reasons why telemedicine is likely to stay. First and foremost, there has been an overwhelmingly positive response to telemedicine from both the patient and the provider perspective. According to an article in the Harvard Business Review, a national Press Ganey survey of 1.3 million completed patient questionnaires found that even though most clinicians and patients were new to virtual visits at the start of the pandemic, patients have clearly come to appreciate them. The surveyed patients were just as likely, or even slightly more likely, to give high ratings to their care providers after telemedicine visits. There were, within the survey, they identified room for improvement regarding the technology itself, but overall, providers and patients have thoroughly enjoyed using this technology. And the second reason is one of the biggest predictors of telemedicine success will be how CMS dictates payment for services. Now, CMS's 2021 Medicare Physician Payment Schedule enacted meaningful expansions of telemedicine services during the public health emergency. These will be effective until the end of the calendar year in which the emergency ends. So this expansion will likely continue through the end of 2021. Now, telehealth advocates had really been hopeful that CMS would make extensive permanent coverage expansions in the Medicare program. However, what came to light throughout this was those changes will actually have to occur through Congress. But interestingly, we are starting to see a greater lobbying effort on behalf of telemedicine, really because of provider acceptance and the use of startups and interest that this has generated. The Telehealth Modernization Act was introduced in the House and Senate at the end of February, and it will be interesting to follow the progress of this act in the months to come. And finally, although private payers tend to follow what CMS is doing, we should also be on the lookout for emerging trends in private payer expansion of telehealth services. It should also be noted that over the last year, many startups have identified the value of telehealth and have started to develop new technologies to further this method of accessing healthcare. As an example, Amazon offers a service to its employees. It's called Amazon Cares, and it's an app. It's an app-based primary and urgent care service that has only been available to the company's employees in Washington state. However, Amazon recently announced that it will be expanding the service to employees in other cities. And who knows, this might be an example of how we can use telehealth to further disrupt the healthcare marketplace. So I know that this last slide was a lot to take in regarding policy updates and the future of telehealth. And it really will be interesting to see how telemedicine is adapted in the future. Now, I'll give a few tips for utilizing telemedicine services while we are still in the public health emergency. And I will say many of these will still apply when seeking healthcare in general, regardless of the state of telemedicine. The first is to capitalize on the convenience of telehealth services. Throughout the pandemic, we have been forced to juggle more than ever, and telemedicine really has given us somewhat of a reprieve from navigating the long waits and travel times to get to doctors' offices. If you have care needs that you and your physician feel as though you can meet these via telemedicine, then this might be a great option to continue to do during this public health emergency. Telemedicine can also increase patient engagement. One of the fantastic bonuses of telemedicine has been this ability for patients to interact with their physician in a one-on-one environment. The data seems to indicate that the face-to-face interaction has been well received and can improve the quality of the conversation between patient and provider. One of the key actions that we can take to better advocate for ourselves within the healthcare system is really to establish a home base in which we start conversations about what we need. This is most likely achieved through a primary care provider that you trust and are willing to seek consistent care from. We have so many options these days, from urgent care to retail medicine to virtual physicians. It can sometimes be challenging to create that consistent care story. And finding a primary care provider that can greatly help in navigating and ensuring access to services needed for your unique needs. Telemedicine can be a great way to enhance this dynamic and build a trusted group of providers that fit your needs. If you like the option of telemedicine visits, then you can ask your provider and see if they will be willing to do a visit via a telemedicine format. Oftentimes, we may have an initial visit and then think of follow-up questions or might want to learn more information after the visit. In these instances, you might find it helpful to request a follow-up telemedicine visit. This will again give you that one-on-one time with your provider to ask more questions and clarify any information. To share a personal example, I have used telemedicine visits to meet with our family's pediatrician throughout the pandemic. And it has not only been convenient, but it has also helped me to develop a much stronger relationship with our pediatricians group. I find myself scheduling telemedicine appointments that I would not normally take the time to go to the office for, simply because it is so much easier to attend these appointments. And on this slide, I've listed a few types of appointments that might lend themselves to a telemedicine visit. As you can see, a common theme throughout these appointments is they are geared towards conversation rather than physical exams, such as discussions about mental health, monitoring medications, or checking in on a chronic disease. And a few other tips: telemedicine is a great option for seeking second opinions, especially if you would have to travel to a different location for the initial appointment. Plus, it remains a great resource for expanding access to providers, especially in rural communities. Another tip: it may be helpful to include a loved one at your telemedicine visit. With COVID-19 restrictions, we are often limited with how many people can be in the office. However, telemedicine allows for another set of ears if needed. If you are interested in telemedicine and are not sure what your provider is doing, then just give them a call and inquire about their telemedicine services. Perhaps they have specific times they are booking telemedicine appointments, or they have specific days that they are using. In addition, check your insurance provider to see if they offer telemedicine services. Some providers have options where you can talk to some payers have options where you can talk to a provider 24/7 for urgent care needs. And when exploring telemedicine options, it is always a good practice to know your insurance benefits. Next slide. Although private payers often follow CMS guidelines, this is not always the case. Plus, private payers may also have specific requirements that impact coverage options. In many cases, copays and deductibles may still apply for telemedicine services. In the early days of the pandemic, many payers waived copays and deductibles to encourage patients to use telemedicine. However, nowadays, many have gone back to this requirement. They may also require pre-authorizations or referrals. And this leads us to our next poll question. It is, what has been your experience with telemedicine visits? And please know that these responses are anonymous. And based on the results, it looks like it's relatively split, with more people having not had a telemedicine visit yet and still navigating the new process. And then also they had had telemedicine visits before. So it really is relatively split amongst the group. So that's really interesting. And if this is something that you are interested in exploring, again, just ask your provider and kind of see what their policies are. One of the most disheartening revelations of the pandemic was the vastly unequal impact COVID-19 had on vulnerable populations. This was seen this was seen across not just the actual prevalence of disease, but in food insecurity, stable housing, job loss, access to childcare, and remote learning. Long-standing systemic health and social inequities have put many people from racial and ethnic minority groups in vulnerable populations at increased risk of getting sick from COVID-19. These populations are experiencing higher rates of hospitalization and death. Inequities in the social determinants of health have historically prevented these groups from having the same opportunities for economic, physical, and emotional health. These inequities are further highlighted by the factors that contribute to increased risk of COVID-19 exposure. And as you can see, the relationship between the already prevalent inequities have been further amplified by this disease. Over the last year, you've likely heard the term social determinants of health, as it has been brought to the forefront of many of our conversations about public health and community well-being. And social determinants of health are defined as conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risks. In fact, it has been discovered that out of the modifiable factors that contribute to health outcomes for either a population or society, medical care only accounts for approximately 10 to 20%. Researchers believe that social determinants of health drive over half of the modifiable health outcomes at a rate of approximately 80%. So, the key takeaway here really is that so much of our health and well being happens outside of the walls of a hospital or physician's office. And the COVID-19 pandemic really has brought to the forefront this realization. And in this next slide, we will talk a bit more about how policymakers are defining social determinants of health. The Office of Disease Prevention and Health Promotion recently launched their 2030 Healthy People campaign. It is a 10-year agenda for improving health in the United States. A new Healthy People initiative is launched each decade, and one of the primary objectives for 2030 involves increasing awareness and understanding of the determinants of health and opportunities for progress. This initiative helps provide measurable objectives and goals applicable at the national, state, and local levels. And Healthy People 2030 takes a place-based approach to social determinants of health, and it categorizes all of the determinants into 5 key areas. You have economic stability, education, access, and quality, neighborhood and built environment, social and community context, and healthcare access and quality. Now, many people in the United States don't get the healthcare services they need. About 1 in 10 people in the United States don't have health insurance. And people without health insurance are less likely to have a primary care provider, and they may not be able to afford the healthcare services and medications they need. Strategies to increase insurance coverage rates are critical for making sure more people get important healthcare services and treatment for chronic illnesses. Some people don't get recommended healthcare services like cancer screenings because they don't have a primary care provider, or because they live too far away from the providers who offer the services. Interventions to increase access to healthcare professionals and improve communication in person or remotely can help more people get the care they need. Examples include increasing the proportion of adults who get evidence-based cancer screenings or increasing the number of community organizations that provide preventative care. And in this next slide, I will provide a few examples of ways the healthcare industry is addressing social determinants of health. And you can expect to see a greater emphasis on social determinants of health in the future. Beginning in January 2021, physicians are now able to document and code office visits based on time and medical decision making. This allows providers to more effectively discuss services rendered, as well as the unique requirements of the patient. This change in evaluation and management codes allows providers to identify social issues impacting the health of their patient population. And through incorporating this information into documentation, it creates a connection to how these issues are impacting the health of their patients. In addition, you might also see more healthcare team members asking questions about your overall health and well-being, rather than just a specific diagnosis. You may also be asked to complete screening tools either online or at the doctor's office. Another tip is to seek out resources from your provider. Talk to your physician about your unique circumstances, even though it might feel uncomfortable or outside the normal scope of the office visit. For example, if it is recommended that you receive a service and you cannot afford it, or if you're having trouble accessing healthy foods and finding a safe place to exercise in your community, mention this to your provider. They may have resources or ideas to help. You can also seek out resources for yourself and others. You may see an increase in community awareness activities, or you can also talk to your church about ways to help or to receive support. You may have an opportunity to also help others through volunteering or mentoring. You might also see insurance companies looking at ways to improve the overall health and well-being. For example, Medicare Advantage, Medicare Part D, and Medicaid plans offer supplemental benefits to address social determinants of health. Examples of available benefits may include meal delivery, healthy food plans, nutrition education, non-emergency transportation, or even home air cleaners for patients with asthma. You might also see an emphasis in this topic from healthcare leaders or even students. For example, in ACU Online's undergrad healthcare administration program, students have an opportunity to take courses in healthcare disparities and community health issues, which can help new leaders think about how social determinants of health impact the overall well-being of society. And that brings us to our final poll question. And it is, what ways can you help address social determinants of health in your community? You can volunteer with your church, ask your provider about community resources, become a mentor, or all of the above. And it looks like just about everyone agreed that all of the above. And yes, these are all ways that you can not only address your individual social determinants of health, but also ways to serve your community and and your loved ones. And now for our final topic, which will be very brief. I wanted to provide a quick update on the ACA and healthcare reform. And as unemployment levels skyrocketed during the early days of the pandemic, many people lost not only their jobs, but they lost their health insurance as well. And although the ACA has been deeply divisive, a New York Times article indicates that it is more popular than it was when it was first enacted. And a preliminary analysis on uninsured rates during the pandemic indicate that the ACA has served as a safety net for millions of unemployed Americans. This occurred through either enrolling in one of the healthcare market plans or enrolling in Medicaid. And President Biden has indicated that he intends to improve and enhance the ACA during his term. However, my guess is that this will occur once the dust settles with the pandemic. President Biden has also he's already made some strides in improving access via provisions in the American Rescue Plan. This new law contains several provisions aimed at making health insurance more affordable for millions of people with lower and moderate incomes. And it also helps people without insurance get coverage. The American Rescue Plan expands who is eligible for ACA premium tax credits, and it increases the amount for certain people already eligible. The plan also provides additional federal Medicaid funding to states that newly adopt Medicaid expansion, and it provides additional federal Medicaid support for home and community-based services. Now, I should mention that the future of the ACA is still in the hands of the Supreme Court. In November 2020, the Supreme Court heard arguments for Texas versus California. This case centers around the individual mandate. And although it is unlikely that the ACA will be completely disrailed by the Supreme Court's decision, it will be interesting to see the final opinion on this issue. And we anticipate that the Supreme Court's opinion will be available this spring. I was kind of hoping it would be dropped today because opinions come out on Thursdays, but that didn't happen. But we will see the opinion come out quite soon. So for a few tips related to the ACA and reform, really just be on the lookout for a greater emphasis on the Affordable Care Act and reform in the months and years to come. And double check if you qualify for subsidies and Medicaid options. Even if you do not use ACA plans, it is good practice to review your insurance coverage and create a strategy for your care options. This includes knowing ahead of time which hospitals are in your network and any physicians that you can see as well. It's also it is recommended that you have a good understanding of your prescription benefits as well. In addition, the Affordable Care Act includes specific requirements for covering annual wellness exams. So even if you do not use an ACA plan, your insurance still must cover certain wellness criteria. So utilizing this benefit can help you to establish that primary care connection if you do not already have one. And finally, I did not go into detail about this, but be on the lookout for recent policies banning surprise medical billing and requiring hospital price transparency. These could help improve out-of-pocket costs and help shape the consumer healthcare experience in the months and years to come. And this concludes my presentation. Just as a brief summary, we talked briefly about the healthcare landscape and how it can be so difficult to disrupt and some of the reasons why that's the case. We also talked about the shifts in healthcare approaches and specifically really looking at how telemedicine can revolutionize and is revolutionizing healthcare, how we'll see a greater focus on social determinants of health from our providers, but then also from our communities. And we also just briefly looked at the future of the ACA and how how the ACA has served as an umbrella for Americans during the COVID-19 pandemic. And within each of these, I hope I was able to give you a few helpful tips for navigating the healthcare system. So thank you all for listening, and I'm happy to answer any questions.
Wonderful. Thank you so much, Megan. And we will open it up for Q&A shortly. And while you're thinking of questions, you will see a link posted in the chat for anyone interested in finding out more about our online degree programs. And you will receive an email in the next 24 hours with a recording of today's session. The follow-up email will also include a brief survey, and we would appreciate everyone's feedback as we continue these webinars in the future. We would also like to invite you to ACU Online's Open House webinar next Thursday, April 1st at 6:30 p.m. to learn more about the online undergraduate and graduate programs offered at ACU Online. We are posting a registration link in the chat for this event as well. Idea Lab's next scheduled webinar will be in May with Dr. Dina Counts. And finally, if you do have further questions, feel free to email us at idealab@acu.edu. We want to sincerely thank everyone again for joining us, and a special thank you to Megan for sharing your knowledge with us today. And we will now open it up for Q&A. So feel free to type your questions using the Q&A feature at the bottom of your Zoom window. And Megan, while we're waiting for other ones, I actually thought of a question through this presentation, because I know that you put a lot of emphasis on the importance of having a PCP. And, even just aside from the pandemic, like we move, we change jobs, or we have kids, so we see, a different type of doctor. So I have to admit, I've not been very disciplined about having a PCP. Do you have any tips on, when things like life disruptors like that happen, how we can try to, kind of create that new relationship with PCPs over time as we change them?
Sure. And that's so true. And I know we all are moving, or health insurance changes, jobs change. So we have a lot of, we're all busy and have a lot going on in our lives. And if you do move and you need a primary care physician, or you find that if someone it didn't quite work out, or you just haven't really established that care, really a first place to start is you can always call your insurance provider, and they can usually give you a list of providers that are in network for you. And that's really a great place to start, because you'll know right away if they'll be covered in your plan. And you want to try to stay in network, because that will help with the overall payment amounts. A few other tips, really we have our primary care physicians that we can seek care from, but sometimes they might be closed when we really need them, or we might not be able to get in, and so that can be kind of a challenge. And so we can find ourselves going, we might have a primary care visit, and then we'll go to a minute clinic, or we'll go to an after hours urgent care center on the weekend. So if you do have to do those types of things, my advice would be to kind of loop your primary care physician in, and just kind of keep them involved in your story, so that they'll know what's going on with your healthcare, or your kids' healthcare. So that's kind of one tip, is just to, find someone that you trust, that you really will feel comfortable going to, that you can say, hey, I'm having, this issue. Can you recommend a specialist for me? Or can you kind of help me to understand where I need to go for help? So they really are that kind of home base, and having that home base can be a great starting point for kind of for addressing your care needs.
Awesome, thank you. And it does look like a question popped up in the Q&A if you're able to view it.
Do you want me to read it out loud? I'm happy to.
Yes, please. I actually
Okay.
can't see it.
Okay. It says, it was mentioned that one of the barriers to healthcare system disruption is the number of government regulatory agencies. What is your suggestion? We see in Texas being kind of deregulation, how poor is our let's see. We see in Texas being the king of deregulation, how poor is our statistics in every respect. I look at the recent power plants infrastructure due to deregulation. So yeah, and that's that I kind of view that question as, are we better, what's best in healthcare, heavy regulation versus deregulation? And we are one of the most heavily regulated industries that I can think of. And that's a hard one, and that I don't really have an answer for that. I can tell you that our students ponder that in some of our courses. I tend to lean towards regulation in healthcare just because of what's at stake. And you literally have people's lives at stake from quality, from patient safety, from everything. So I think that it's here to stay. Can we streamline it? Can it be a little bit easier to adapt and change? Absolutely. And that's something that we'll probably work towards. But I don't think that you could ever fully deregulate healthcare just because of patients' lives at stake every day. I hope that kind of helps answer the question. That's one we could definitely ponder for hours.
And I guess I have a lot of questions because I've been looking at this info a lot. But I also know you mentioned about like the surprise billing thing, and that's been a real struggle for me personally. Is I go to a visit, and then weeks later I get this astronomical bill that I wasn't expecting. So can you tell me a little bit more about how they might be changing that?
Sure, and that's it's still very much new, and I'm not too familiar with like all the inner workings, but basically the idea is, sometimes we'll go, let's say we might go have surgery and we're in network in a hospital. But what happens is maybe your anesthesiologist was out of network in your actual benefits. And so you would receive a large bill from that anesthesiologist or from another provider. And what this law is set to do is really to you're not allowed to do that anymore, and you're not going to get those huge bills. Again, my really true advice on this is to always, if you get a bill like that and you're not sure, try to find out as much, well, beforehand, try to find out as much information as you can ahead of time before you have a procedure done or before you have a specific service so that you'll know what to expect. And most offices can give you a very clear picture of what that cost will be and what your out of pocket cost will be. So if you can do as much information up front, that's always a good practice. And then afterwards, if you do get a bill that seems, and this even goes into not the surprise medical billing, this really kind of ties into just medical bills in general. You can always call your insurance company and talk to them and try to understand what that is. And it could be an error. It could be a surprise medical bill that is not allowed anymore. So always try to dig a little bit deeper and start asking questions. And sometimes you'll find that it could have been an error, or there's ways to start a payment plan or deduct, or even negotiate it away. So just because you receive the bill does not mean you will necessarily have to pay it, but always just kind of take it one step further.
Perfect, perfect. Okay, and I don't see any more. Oh wait, maybe one just popped up in the Q&A. Do you see one there?
Says, I think it is kind of more of a comment, but I think it is wonderful that we are talking about these social determinants of health, but self-responsibility and self-care should also be a part of the discussion. Government cannot solve everything. I could not agree with you more. And we are, at the end of the day, responsible for our own care needs. The conversation and the aspect that I've been really encouraged by with talking about social determinants of health is just really that recognition that so much of our well-being and our healthcare happens outside of the hospital. So having that realization that we need to think about the healthy foods that we're eating. We need to make sure that we're getting the exercise that is necessary, that we are, in a community that's relatively safe. So thinking about those things in the greater picture, I think kind of helps to have a better kind of frame the conversation of healthcare rather than just treating the sick, but keeping us all healthy. Oh goodness. Okay, a billing question, sort of. Here's another question that popped up. It says, "Why is it cheaper for me to pay in cash for a doctor's appointment rather than use my insurance? For instance, doing allergy testing right now, and if I were to use insurance, it was going to cost over $4,000. If I paid cash and didn't use, I don't see what the number, the rest of the, oh, and didn't use insurance, it would only be 1,500. Of course, that money didn't go toward my deductible." That has to do with what your deductible is, what the insurance companies actually have contracts with healthcare organizations, and they set payment amounts, and those amounts may vary. And then there will also be a separate self-pay rate that's set. And so that is a really challenging situation to be in, and it is not ideal. So that kind of goes. I don't want to go too much into the in depth about that because it kind of depends on each person's plan. But the reason is because payers contract with hospitals for certain amounts, and if that's the amount that the hospital or office is contracted to pay, then that's unfortunately what it is. But oftentimes that's reduced for self-pay patients. And those kind of unique questions, I'm always happy to kind of consider like on the side too, because those get really medical billing and coding is extremely complex, and I get to be, in all honesty, I have specialized in this, and it still gets quite confusing.
Perfect. Well, thank you so much for your openness to discuss these things. That a lot of this is so Greek to so many of us. So we appreciate your patience and willingness to help. To respect everyone's time, because it doesn't look like we have any more questions for Megan today. So we'll go ahead and close out today's session. But if you do have further questions, like Megan has said, you can definitely reach out to ACU Online and Deckham Center Solutions, and we can connect you. acu.edu/online and acuidlab.com. I'm sorry, DeckhamCenterSolutions.com. Goodness, too many websites to talk about. Thank you again for joining us today at ACU ID Lab, and we definitely hope you have a blessed day. Take care.